Very good morning, everyone. My name is Mrinal Saxena. I lead the product for the Heartprint program at Philips. I'm as well joined by Priya Ravichandran, who heads the engineering there. But before we get into the product and talk about our innovation and solution, I'll first probably emphasize on where it all began and why did we start this in first place. And for that, it's important that we understand the challenges with the traditional healthcare system. And of course, the foremost will be is reactive in nature. We treat disease when the symptoms occur, which mean we would have ignored all those subclinical changes for a very, very long time. And because of the late intervention, late identification, that would also add to the cost burden on an individual, right? And then sure, you have multiple stakeholders involved, your clinician, your physicians, your hospitals, insurer, your employer, who have visibility of your health data, but that is so much in silo and that is so fragmented that it's almost impossible to draw a larger picture from that. Now, that brings me to the point that the importance of proactive or preventative care, we call it. So it's need of an hour that we move from reactive to proactive, from treating diseases to preventing one. Now let's look at the entire health spectrum, what we have today. On one end, you have your entire hospital, the ecosystem setup, where of course you have all the sophisticated diagnostic tools, treatments available. But what do we have at the other end? Wearables would be the answer, right? And while wearables are fantastic at your detecting emergencies, while the event is happening, but I've literally talked about on a day-to-day basis, right? The sheer amount of data it generates, that can be overwhelming. Now, what do we truly need? The need here is that we combine all these data points or the proactive, the whatever the intent we have, with some sort of simplified intelligence, and that is precisely where AI comes in. We just need, in terms of proactive care, number one, anticipate, detect the problem early on with periodic check-ins, with continuous monitoring. Number two, personalize. Get a personalized recommendation, tailor-made recommendation on your lifestyle choices, on your day-to-day things you indulge in. And third would be empower yourself with some sort of actionable insights. What if someone could come and tell you that if you don't pause now, probably in a month or years, a catastrophe is poised to happen. And that is exactly and precisely the problem we are here to solve. And that is the gap with Philips Heartprint bridges between your ecosystem which your hospitals have, and one end you have wearables, and there's a huge void in between. What about players outside hospitals and the clinical ecospace, right? What if I tell you that a phone in your hand is so powerful, and just using the sensors of your phone, this could be your own personal compass. It can help you navigate your health landscape. What if it can tell you that, oh, Mrinal, looks like you haven't had a good sleep probably over last week. It's showing up in the data. What if we could have a system we can process all the data points, all the complex signals, and help simplify in a more meaningful, help us unlock the power of all the data it has, and tell us where you are heading. It could tell me, looks like things are going good, whatever you're doing. Earlier, I heard Dr. Priyanka speak about that. One of the things in the panel discussion is that what if we could attack the symptoms early on, before the disease occur at kick-in? We also heard Shweta talk about that. She came to know about the resting heart rate, the importance of it off late. What if this could tell you that heart level, fatigue level of your heart is quite high? Looks like our heart strength is somewhere moderate and you should be doing something about it. So heart is that one litmus, one indicator which could tell you multifacets of your health, right? Right from things are doing okay, hey, pause, you have something to act on, or to the point, looks like things needs to be escalated, why don't you visit a doctor? Now with this, I'll hand over to Priya, who'll quickly walk you through the quick demonstration of the same.
Thank you, Mrinal. Nice to see you, everyone. I will give you a quick walkthrough of EKYH. It's one of the important AI-based solutions we have built on the Heartprint platform. So to start with, I would like to reiterate a bit of what Mrinal said, right? Why it matters. So today we have a whole lot of data points. I think many of us are using a lot of health, wellness apps as well, which gives us scores, trends, dashboards, etc. But I think the most important thing for us is how do we connect the dots, right? How do we figure out what it means for us, right? What do I do today with it? What are the small changes that I need to make, right? And when do I need to get help, right? So the decision friction is the main problem that we're dealing with today. So Know Your Heart, or EKYH as we call it, is set out to solve this gap, right? Okay. So getting into the product, what it actually is, there are four important pillars that define what EKYH is. The first thing is it's longitudinal, because a single measurement that we take any day might be inaccurate, right? So it's important to observe people over a period of time, right? Learn how their health is drifting, showing the subtle patterns, compare them to the baseline, and then give you guidance. That's the first intent of EKYH. The second thing is it's like a compass, right? It's your health GPS. At any point in time, it will tell you what simple things that you need to do, right? We try to deconstruct the whole health journey into simple day-to-day activities that you need to take care of. The third part is it's dynamic, right? Every time you check into your Heartprint app, every time you do your symptoms check-in, the compass keeps recalibrating itself. And the fourth one is it's a companion for your health. So it's not intrusive. Whenever you need to have a conversation, clarify certain doubts that you have about your health, you can pick up the AI companion that comes with this feature, or at sometimes the AI companion itself will nudge and ask you certain things, whether you have done certain things, whether how you're feeling about certain changes you've made in your lifestyle. So all these things put together, the basic thing is to ensure you to take day-to-day decisions, right? We are not putting you in a big journey or a clinical workflow protocol or anything. It's to keep things simple and decide what to do next. So a couple of other important aspects, although these are the four main pillars, right? Two supporting aspects that we have is bring in the population perspective, because we are an extension of the place that we live in, right? So the environment conditions, we compare ourselves with people of your age and gender, for example, people in your city, people in your organization, which gives you much more better perspective of your health, right? The second thing is whenever you need to connect to somebody, right? So you know kind of where you are placed, but if you have to reach out to, some helpline or connect with your family and friends and take care of their health, we have that functionality also packaged as part of the EKYH program. So as a next step, let's take a quick overview of how the app looks like, right? So this is the main page of the app, right? It's simple. You have a compass. As Mrinal explained, you have various states. Stay on track, all clear, you're looking good, right? You keep reinforcing what you're doing. Keep an eye is when you see some changes and then you need to, so that's a compass. And next you have a simple guidance panel, and in plain English it tells you what you should be doing now, right? All your other, health metrics are all secondary. You can pull it up whenever you need and see them. But the key thing is, it tells you what you need to do at this point in time.
Inform that time is about to be up. On a closing note, just a few seconds more on as to why this is super important now. I'll just throw some numbers at you. The current reality, over 100 million diabetic, 136 to 140 million pre-diabetic. 1 in 4 deaths is because of CVD. Close to 35% people who are impacted by hypertension. And all of these are preventable. And a simple device, your phone, what it could be, if it could be so powerful. Of course, we use PPG, use your finger, position behind the camera, it could get the signals, we could integrate with variables. But data is one source of truth. What we need is truly draw a longitudinal pattern and guide you on so that you don't get into the territory of, I wish I could have done it earlier. Thank you so much.